Hi guys, or what I should say this time is Здравейте на всички. Добре дошли на Жребс на Chavane. So quickly, this video is a 15-minute Bulgarian crash course about how you can slightly improve or enhance or modify the way you could go about your conversational skills with a patient who speaks Bulgarian when it comes to clinicals, because I know, like, I'm a third year student. This channel is aimed at third year students, so I thought it would be fitting to make a video about how is it we can at least improve slightly the way we talk to patients. So going into it quickly, um, just a few general tips before I get into it. The first tip that I really want to talk about is listen more than you talk. So this is not just even from a Bulgarian patient point of view, even for like yourself as a doctor in any clinic, any clinical world in the world, you want to be able to actively listen. So that means asking the right questions, because if you ask the right questions, the patient will give you an appropriate answer. The patient will open up, they'll feel like they're sort of included in the conversation, and the less you talk and the more opportunity you give them to talk, it will make it much more easy for you to sort of get a diagnosis in. So it's happy days for everyone. Yeah. And the second tip, it's a bit weird, but essentially is to manifest what you expect or what you anticipate to hear. So for example, I want you to imagine that you are a respiratory ward, for example. What kind of buzzwords would you anticipate to hear? So things like, well, I know I would want to hear things like breathing, asthma, allergy, inflammation, coughing, sneezing, dry cough, phlegm. If I was at a surgical ward, what kind of words would I expect? I'll probably want to hear bleeding, operation, cast, bandage, infection maybe. So the idea here is 80% of the time, you're going to always experience a conversation that has words that are part of a repeating theme. So basically, when you're talking to a Bulgarian patient, for example, you always want to have that in the back of your mind that you expect a few words that you already know about based on a context. So if you're at a respiratory department, you know that the patient you're going to be speaking to has symptoms related to respiratory. So you kind of expect to hear breathing and all that. So if you know the key words, even if the patient's waffling, if you know the general sort of main ideas, the main keywords, you could get all those keywords that the patient has just said, put into a sentence, and you can kind of get the general idea of what they're trying to say, even if the patient is speaking in total Bulgarian and you have no idea what they're talking about. The final tip for me here is quickly is that you should be able to always note new vocabulary on the run. So when you're on the clinics, I recommend having a journalist notepad maybe, and when you hear a word or a keyword that sort of sparks your interest, or you're curious about what it means, quickly note it down. Maybe ask the doctor what it means. Go back home, for example, and I don't know. I recommend putting in an Anki or flashcard app, or just repeating it to yourself and using it in different situations. And yeah, so the more vocab you're exposed to, the more sentences you can form. So the more easy it is, the more natural it becomes as time goes by. So just quick disclaimers before I get into it, because I haven't got that much time. This is only like a 12-minute video from now on. So essentially, this is just a refresher from last year. So I'm not going to be teaching you vocab from scratch. I won't be teaching you like pure grammar from scratch. What I'll be teaching mainly is just quick fire questions that you can ask the patient to get the ball rolling. So essentially, talking with a Bulgarian patient, to me, I look at it as talking to a girl with a dry personality. So what I mean is, um, Bulgarian patients, you know, most of them won't be able to speak English, and that's fine because that's their country. So they'll be a bit reserved in the way, that when you approach them, they'll be a bit reserved. They won't be able to, open themselves up that much. So the idea here is to ask the right questions. If you ask the right questions, you're going to cause a snowball effect and a chain reaction, and then they'll be able to tell you as much information as possible. So what do? You ask big general questions, and I'm assuming most of you know this already, yeah, from last year. So od какво се оплаквате? So what are you complaining out about? So notice how it's оплаквате and not оплакваш, because he's not your boy, he's not your brethren, he or she is a patient, yeah. So you got to keep it formal, keep it professional. От кога имате тези оплаквания? So now we're not talking about not just what the situation is, when did it happen? So now you have a time frame. So now you're starting to, pick up the piece of the puzzle and sort of building it. So I always recommend doing open questions, but sometimes you obviously do have to ask closed questions. So things like imitali drugi symptoms. So do you have other symptoms? Because if you know other symptoms, you can sort of make relations between the main symptoms that they're complaining about. And this is my favorite question. I use it in my examination last year. Какво вече сте направило or направила based on the gender против I don't know, like asthma. So this question basically means what have you done already against this a certain condition or a certain complaint. This is a really good question because then it gets the patient thinking like, oh yeah, what did I actually do before I even came here? So if you know what the patient did, you can kind of again build jigsaw puzzles and sort of get the whole diagnosis in. So that was general. So this is how you. So the previous slide was talking about how you start off. Now, based on the patient himself, the patient themselves, and what ward you're in, or at least if you have an idea about the context of the patient before you even meet the patient, depending on the the type that we're talking about. So, for example, in this slide, I'm talking about respiratory here. So, like I told you before, always think about keywords. So here's about temperature. Пермерихте температурата. Have you measured your temperature? Ако е така, so if it's so. Колко е град, колко е. So what is the, what's the, how much is the temperature? What's the, give me a value. Yeah. Immediately allergic към нещо. So do you have any allergies against something? Кашлятели, are you coughing? Immediately главоболия, do you have a headache? So you can see that these are all things that you expect within a respiratory sort of like mindset, a respiratory theme, headache, coughing. So then I have more here. So for example, imitali zatrudneno dishene. So dishene means breathing. Zatrudneno means difficulties because it comes from the word trudno. So do you have difficulty breathing? Another one could be useshli hriptene vegardita. So do you gardita, I think it is. So do you feel wheezing in your chest? Chusvetili odpadnolost. So do you feel fatigue? So you can kind of get the idea here that I'm trying to show you that these are respiratory related questions. Yeah, they could be asked anywhere else, but if you have no idea about Bulgarian, you could probably use these starters to get you going. Trauma specific. So with trauma, you always want to think about the pain, like the character of the pain, when did it happen, where's the localization of the pain, and also the situation itself. So how did it even happen? What happened? When did it happen? So so where are the pains? Къде локализирате на болка? So you don't even need to know Bulgarian to know what that question means. So it means where is the localization of the pain? Опишете symptoms. So describe the pain now. So this is giving the patient a big sort of, it's an open question. So it allows the patient to think like how severe is the pain. You can even quantify it. До скалата от 1 на 10. So from a scale between 1 and 10, describe to me the pain. Каква е болката? So what is the character of that pain? Is it intolerable? Is it bearable? And in terms of the situation itself, so the case, how did it happen? Какво се случи? So what happened? Кога се случи? When did it happen? Как се случи means how did it happen? Particularly with chronic diseases, which you will definitely get exposed to in third year and onwards. So for example, things related to urinary infections or diseases. So имали болка когато уриниране? So is there pain whilst there's urination? So this is specific to a urinary disease like a бъбречно-каменна болест, which means kidney stone disease. Чувствате стягане в гърдите? So do you feel tightening in the chest? This is more heart related. Вие ли виз says viat. That sounds very French, but it means do you feel dizzy? How's your consciousness? How's your dizziness basically. And this is obviously related to the heart. So I have more heart-related questions here. So immediately проблеми с очите, зрението ли или ушите? So do you have problems with your eyes, your sight, your senses, your hearing? Because obviously that is affected when it comes to heart disease, chronic heart diseases. Някой в семейството ви страдали от hypertonia? So семейството meaning the family. So is there anyone in the family that already suffers from hypertension? And that's obviously a very important question to ask because it can run in the family. Specifically to the history taking part, also known as the so-called anamnesis. This is a very, very big sort of broad topic, but I've sort of narrowed it down to two main things that you might want to ask when it comes to an anamnesis. So this is literally a history taking from point A to point, Z, like the whole story about the patient. So you can talk about the profession, the patient's profession. Работаете do you work? Учите so do you study? So then I've put here in the table the expected answers that you might expect the patient to say. Obviously, I'm not going to say everyone, but you could take a look at this table, take a picture, note it down, whatever you want to do with this. But definitely have an idea of, when it comes to history taking, that you want to get the whole idea of the patient. So, spasvatili dieta, which means, are you on a diet, and what kind of diet are you on? Kakva dieta spasvatis, or what diet are you on? Just because I'm out of time. Now, in terms of the patient, in terms of the doctor's perspective, what can you say or do? Like, how can you respond and tell the patient about what actions you want to take further? And this all relies on the future tense. So to briefly summarize it, all you do with the future tense is literally smack a ste right in front of the present verb or whatever you want to talk about. So for example, ste plus, and then I put 5 big verbs that you're likely to definitely sort of use in the clinics. Pregleda meaning examine, predpiše meaning prescribing, premerja measure, presluša to listen, and napravja to sort of do or make or whatever. So for example, ще pregledam grlto, I will examine the throat. Ще predpiše paracetamol, I will prescribe paracetamol. Ще napravja rentgenova snimka, I will do or order or make an X-ray. Regarding commands, so there will be times obviously where you're gonna have to instruct patients what to do, like in terms of advice when they go back home, what are they expected to do. So a ballpark sort of golden rule to take home is that most imperatives, like again there are some niche rules, but generally if you want to just get the gist of it, most imperatives end in ite in front of the verb. So for example, pite, which means drink, or počívajte si, which means rest up. By the way, if you don't put si here, it means like die, basically. So instead of imperatives as well, if you want to make it easier for yourself, you can also say travada, which means I or you or we, whatever, must something something. So for example, travada napravia rentgenova snimka, which means I have to do an X-ray. So instead of saying "Štepek napravia rentgenova snimka," which means I will, here it's more like I must now. Трябва да, направя рентгенова снимка, or трябва да пие вода, like you have to drink, water. So you can either make it an imperative with the ita part, you can even say you must using трябва да. Да, това е всички. Благодаря ви много. Ако имате някакви въпроси, изпратете ми съобщение на YouTube или Instagram към Silent Learning. I'm going to let you guys decipher that one. I know it was a bit rushed, but literally the whole idea here was to just refresh your minds before you enter the hospital. So if you have any concerns, please message me. And yeah, thank you very much, guys.